Hello and welcome to Health Chat program. This is a program that looks at various health issues and other related issues concerning our health and our well-being. We are out here, wanting to have a conversation with Director General from Zambia National Public Health Institute to just fill us up and just give us an overview on how we are faring as a country in terms of disease.
Welcome to Zambia News and Information Services, your media and communication hub. Need a professional space? We offer state-of-the-art studio hire for sound and film productions. Experience comprehensive news coverage and in-depth features that bring you closer to the stories that matter. Capture your moments with our professional photography services, perfect for events, portraits, and more. Looking for eye-catching visuals? Our graphic art and design team will elevate your brand with custom solutions. Host your next event with confidence. We provide high-quality conference systems and public address systems tailored to your needs. Contact us today at zanismarketing@gmail.com or call or WhatsApp 0773 809 040. Zanis TV, the People's Channel.
So with me, I have Professor Roman Chlengi, who's going to take us through and just fill us up on how things are currently in the country. Welcome to today's program.
Thank you so much and good afternoon.
We are happy to have some space with you so that you can fill us up on what is happening in the country.
Always a pleasure. We are civil servants. We are servants of the people, so we've got to be responsive to communicating with the public. So we're grateful for the partnership that the media gives, so we are able to engage and reach the country and beyond. So very grateful for the opportunity.
All right. For the sake of viewers who are listening to us for the first time, they would want to know what ZNPHI is and the role and of course their mandate. What is ZNPHI?
Okay. So the acronym is a bit of a tongue twister, but it is ZNPHI, that is short for Zambia National Public Health Institute. Yeah. So we are an institute because we are a statutory body that is mandated by an act of parliament. So the institute was established by an act, and an act which foresaw that in the manner in which the health service delivery is set up in the country, there is a bit of a gap. So the act then came up with a mandate that is specific to what we refer to as a specialized arm of the government that provides a number of activities. Top on those is what we call surveillance and disease intelligence, emergency preparedness and response, public health laboratories, and coordination of One Health activities. These are very loaded statements, but I think in simple terms, it is that we are mandated to be looking out for what threats, what challenges are imminent or coming up to affect people, animals, and the environment. That is the One Health angle to our mandate. But principally really is to be the eyes of government through the Ministry of Health to be able to sense. By surveillance basically means we have eyes looking everywhere for signals of problems. We particularly engage with emerging threats. We engage with outbreak-prone conditions, and I think it's important for the public to appreciate that by outbreak-prone, it means we are watching what is acceptable as normal across the country and the health system. When malaria is happening, it is important, but we have it all the time. We are watching. When there's HIV, there's TB, we are watching the numbers. When they start to go above what we perceive as normal,
Mm-hmm.
then it becomes a spike of interest to the institute.
Okay.
When we get new numbers, new diseases coming in, your COVID, your Mpox, your Marburg, it becomes the institute's job to really quantify what is the problem, how can we quantify it, what can be done about it. Therefore, emergency preparedness and response system, very important to our mandate. So the Public Health Institute works as a specialized arm of government. We really support, under the Ministry of Health, the work of the ministry to make sure that the ministry has information on these trends, on what is really happening, so that as policies and policy pronouncements are made, they are based on accurate information. So we are in the back end to provide that kind of information to the ministry.
DG, you've mentioned of surveillance, preparedness, and these responses that you give to outbreaks and any other disease that we can look out for. Are there specific programs that you are looking at currently, looking at the current situation, before we even come to what is prevailing right now? Any program that you're looking at?
So we have very many programs. You'll be surprised. I think that because we are not always in the forefront, you come to us when you have an issue.
That's the thing.
But on a day-to-day basis, we are incredibly busy. Okay. In what you consider quiet times, we are basically doing risk assessments.
Okay.
We are busy identifying what are the risks, what are the more likely problems to happen. And when we identify those, we are coming up with programs. What do we need to prepare in case that happens? Mm-hmm. And we are busy coming up with programs to have the required diagnostic competence, okay, diagnostic capability. So, for example, you've not heard of a confirmed Ebola case in Zambia.
No.
But as that happens in the region and in the world, the work of the Institute in the background is to ask ourselves, how will we even know if we have a case of Ebola? Mm-hmm. So we are very busy to come up with a diagnostic capability. What kind of personnel will we need to deal with that? Mm-hmm. If we have a case, what protective gear are we going to need? What protective treatments are we going to require? Yeah. And start putting those in place so that should a case happen, then we are able to quickly respond to that. So we have, in our surveillance field, we have many programs. We have programs, for example, that are looking at mortality surveillance. Mm-hmm. What are people dying from? Exactly. How many people are dying anyway? Mm-hmm. And what are they dying from? Okay. So that if we see unusual patterns, it becomes an important issue. So in the background, that we are doing all the time. In the health facilities, there are these conditions that the doctors are attending to every day. Mm-hmm. And every day we are getting that data, mm-hmm, and we are looking at it. Is anything unusual?
Okay.
So continuously, and now with the One Health frame I talked about, yes, we are also interested in diseases that affect animals and can affect humans. Okay. So you will hear us talk about diseases like anthrax, yes, diseases like rabies, mm-hmm, those diseases which are predominantly affecting animals but can affect human beings. So we are always having programs that are working around these kind of situations. Yeah.
Okay. You've mentioned of surveillance, which at least you have mentioned one or two things that you are doing. But what of in terms of preparedness and response? Any measures that are in place to see to it that we are adequate in the way we are responding to these emergencies?
Thank you very much. So let me break it down to you,
yes,
this way. The Public Health Institute is organized, it's governed by a board, mm-hmm, then there's myself as a director general, yes, then I have 6 directorates. Okay. I'm sure you didn't know that. I have 6 directorates. I have a director and an entire team, mm-hmm, who are looking at surveillance work. And surveillance has very many arms. We have what we call the event-based surveillance, we have the indicator-based surveillance, we have the mortality surveillance. These are all programs that are running continuously. Okay. I have another director responsible for emergency preparedness and response.
Okay.
That director's job is to prepare for emergencies. Every time there's an emergency, they have mechanisms where they trigger what we call incident management systems. Then you trigger when there's an issue like an outbreak, an IMS, incident management system, is triggered. Now, before the event, we are always training and drilling our teams to be able to set up these kind of systems, so that when the event happens, it comes like that, and we have rapid response teams under that directorate who immediately moves in like swarms. And now we are setting provincial level teams and in some district level teams in the interest of rapid response. I have another directorate, which is public health laboratories and the network. So these are not your laboratories that you see when you go to UTH.
What's the difference there?
There's a very big difference.
Okay.
So the labs that you know are called clinical labs. Those are laboratories that are set to support the decisions of clinicians as they attend to patients.
Yes.
We run a network of laboratories that are not designed by nature for that purpose. They're designed by nature to identify unusual things, outbreak-prone conditions, and so they can make us make decisions very, very fast. So those labs, we run them separately. And so I have a whole director and his team of laboratory scientists, and we have satellite labs across the country. We also have mobile laboratories, which we are able to deploy to particular places, because these are public health labs. They serve that purpose. Now, I also have a directorate called Workforce Development.
Yes.
Workforce Development looks after what kind of resources are these technical fields going to need in terms of personnel, in terms of the skills, what kind of training do they need. And Workforce Development also looks across the country through all our healthcare workers. What cadre can we have in the front line, and what training do they need for us to respond to these emergencies and public health threats?
Okay.
Now, I also have another director whose job is strategic planning and information management.
Okay.
So with what I'm describing, you can imagine that there is an influx of data every day, huge volumes of information coming in.
Yes.
So I have a whole director and his team of analysts who have come up with programs and visuals that then are deciphering through all this information, and when there are triggers, then that comes to attention, then we deal with that.
Yes.
So we have our statisticians, our analysts in that strategic planning and information management. They manage information.
Okay.
Basically translating data into information. There's a difference.
Yeah.
Data is all these weird numbers which you can't make sense of.
Yes.
They make sense of those numbers and then translate that into information which we can either communicate or make decisions upon. And lastly, I have another director, 6 of them.
6 of them.
Yes. Another director with their team whose job is public health policy, diplomacy, and communications.
Okay.
As you can imagine, all the information coming through all these things I'm describing at some point has to be synthesized into policy information, has to be synthesized into information like this, which we can deliver to the community, which we can communicate with the health promotions and really reach out to the grassroots and communicate. So this is how we are structured. We are a fairly large organization with active activities all the time. You come to hear of us, there's a cholera outbreak,
there's
mpox, or there is meningitis, then you hear of us. But we are very active in the background. Continuously.
Okay. Well, viewers, you're still listening to Health Chat program. We are actually conversating with Director General from ZNPHI just to fill us up on the current situation in the country and how best we can actually manage this situation. Professor, there's an issue, just the other day, the minister actually did make an announcement of an outbreak of meningitis in Wapula province, to be specific, in Mwense. How is the situation? Or maybe before you even go to the situation itself, what is meningitis?
Yeah, thank you. I think that's an important question.
Yes.
Meningitis is a loaded word. It's a typical medical term that we use in the medical language. Literally, it means inflammation of the meninges.
Okay.
Now, the meninges are these blankets or membranes that cover the brain.
Okay.
There are these meninges that cover the brain, and they continue down through the neck into the spine.
Okay.
You know,
Yes.
because you probably know that the spinal cord is part of the brain. It's
Yes.
a continuous organ from the brain. Then they continue and go down like that.
Okay.
Now, when there is inflammation, the late term for inflammation, actually in medical school we're taught, is like an insult. You injure it, you hurt it,
Yes.
it then becomes inflamed. Then every time in medical terminology you hear itis, laryngitis, pharyngitis,
Okay.
meningitis, all those things, it means whatever you started with is now inflamed. Itis
Okay.
refers to inflammation
Okay.
generally. So meningitis is inflammation of the meninges. So put simply, when you bang your finger on the door, it becomes swollen
Definitely.
and very painful.
Yes.
It is inflamed. Or when, I think the common example is tonsils. When you have
Yes.
an infection on the throat, it looks red and it's painful when you swallow, right?
Yes.
Sometimes even when you move your neck, it's painful. The tonsils are inflamed. In other words, you have tonsillitis,
Okay.
inflammation of the tonsils.
We know it as
Now-
just tonsils.
Aha.
Yes.
Now meningitis, likewise, it means there's something wrong in those blankets that cover the brain
Okay.
and the spinal cord.
But what causes
Therefore,
that maybe?
They are rigid because they are swollen and they are causing a lot of
A
pain.
lot of pain.
So inflammation of the tissue that surrounds the brain and the spinal cord is meningitis.
Meningitis.
Your next logical question is what causes
What causes that? Yes,
That's
for
obviously
sure.
the natural
What
infection.
causes that?
So there are many causes of inflammation. So in my earlier example, I gave you two examples. One is mechanical. There's an injury,
Yes.
road traffic accident. You stretch, you sprain your ankle, you shear the tissue.
Yes.
Then it becomes inflamed. It is swollen. It is painful because it has been disturbed. So it can be mechanical.
Okay.
Like you are in an accident, head injury.
Yes.
The key sign will be meningitis because you have sheared the membranes.
Okay.
So they are swollen, they are bleeding, they are painful. But it can also be caused by infection.
Okay.
And infections are in various categories. There is what we call bacteria,
Exactly.
there is what we call viruses,
Yeah.
there is what we call parasites, there are also fungi. In those bodies of microorganisms, there are some that can infect the human body through different routes
Yeah.
and find themselves in the brain tissue or in the meninges.
Okay.
The net result is that there is now inflammation.
Okay.
Then you get signs of meningitis. We call it in technical language meningism.
Okay.
Because they are inflamed, it's so painful, you can't move your neck. Signs of meningism, neck stiffness.
Okay.
You try to, it's very
You
painful.
can't
In fact,
actually,
the
because you
muscles are
can't even twist
guarding, you
around.
can't move them because it's inflamed.
Okay.
Very potentially dangerous condition because obviously it's brain tissue
Brain
involved.
tissues, yeah.
And if it's an infection, it will obviously be underlaid by feeling unwell. Then there is a raised temperature. There may be eyes affected. There may be vomiting. There may even be diarrhea sometimes because the system is disturbed.
Okay.
But typically you get the first sign of meningitis is rigidity of the neck.
Of the neck. Wow. So if we look at that and maybe we talk of, the demographics, any ranges in terms of maybe ages, or maybe you talk of maybe female, male, who are mostly affected when you look at this meningitis?
Meningitis is a general term, and
Yeah.
that's why I'm laboring to explain to you.
Yes.
So different causes have different characteristics, or we call it epidemiological presentation.
Okay.
So there is a particular type of meningitis that will affect children. There's a particular type of meningitis that will affect people who are immunocompromised. I'm sure in the years past you must have heard of cryptococcal meningitis.
Yes.
In your
Quite
AIDS patients.
some technical terms there. Yes. Yes.
So depending on the condition or the cause, there are particular characteristics. So there is meningitis that will typically affect children. For example, it's caused by a virus, we call it Haemophilus influenza, which is why when you see in our immunization program, we immunize against particular infections, because we know that if the child gets it, getting meningitis is a difficult condition because it may affect the brain. So the characteristics of the populations affected will be determined by what is it that is causing the meningitis. Now, I know you want me to talk about meningitis because of the reported outbreak.
The reported outbreak, yes.
So, typically, meningitis caused by bacteria is caused by a bacteria we call meningococcal meningitis. It's called that because it was first described having been isolated in the meninges of infected people. This kind of meningitis is a typical outbreak kind of meningitis, and it is rapidly fatal. It's very difficult to treat, and even when you've treated it, usually there will be what we call sequelae or consequences that someone doesn't recover too well. And it has a very high case fatality rate. What we have in Mwense, which is what you're interested in, our teams moved in immediately. The report remember I started describing surveillance and what we do in the background? The moment we see something unusual, then we move in like swarms to go and make sure we understand what is going on. So our teams are out there already, and in the cases that were reported to have died, 2 of them in a learning institution, and in the cases that were hospitalized, samples have been taken. Unfortunately, because of what I've been describing as our preparedness activities, our laboratories now have what we call multi-pathogen diagnostic capacity. So we can pick whatever infection is in there as long as we get a correct sample. And we are using a very proficient technology now. We call this PCR-based technology, polymerase chain reaction technology. This is technology that will detect the DNA of what is in a given sample, and based on the DNA, those sequences are specific and unique, so they will tell us exactly what it is. So the cases that have been reported are due to Streptococcus pneumonia. And this is unusual to us. Why? Because it has caused severe sickness and death. Streptococcus pneumonia is so common. If I take a swab on your throat, I'll probably find it. It is so common. We call it a normal flora. In an average nostril or throat, you will find a lot of strep pneumonia. It is very exceptional circumstances that it penetrates what we call the blood-brain barrier and causes an infection in the meninges and causes meningitis. It is not a typical outbreak condition. It is only being reported as an outbreak because in this instance, it's unusual for it to kill in the way we've lost the two, and in the way we have so many admitted. Our biggest concern was, are we having meningococcal meningitis, that thing I talked about? That is deadly.
Okay.
Strep pneumonia, I think as our team conclude their investigations, because now we have people in the community getting samples, trying to understand, trying to do genetic sequencing of what has been isolated in this, to understand, is there something different in the genetic makeup of this strep pneumonia? Because we know it can cause disease, but in the clustering of the event, to your question,
Yes.
where so many people get affected and you even lose two of them, that is unusual.
Okay.
So I don't have an answer to your question,
Okay.
and we are trying to find out.
Okay.
I trust that in a few days I'll have an answer to your question.
Okay.
Yeah.
Okay.
So we're trying to really understand what is the characteristic of this and why has it
Yes.
happened this way.
This way.
It is not a typical meningitis outbreak.
Okay. We're looking at this type of meningitis, and we're talking of it to be just in one province. Is there anything that we can attribute it to, or it is just the happenings that can happen anytime, anyhow?
Usually we want to explain everything, and usually there's an explanation. But in medicine, professors in school taught us never say never.
Yes.
Unusual things in medicine happen, which sometimes you can't explain. But we try our best to investigate in order to have an answer. Because if you don't have an understanding why, it's very difficult to prevent.
Yes.
And which is why institutions like your ZNPHI exist, is so that we can spend time to really get into the nitty-gritties, the nuts and bolts of a given outbreak, so we can understand as much as possible in order to inform policy on how to mitigate. And that's what we do in the background. But in this specific case, I think that our teams have moved in, our teams are investigating, and so far we know what has been found in these patients and in the demised individuals. But as to why is a question that maybe we will answer later. We may never even answer it. But for now, we are trying our best to get the answers.
Okay, you've mentioned of surveillance, that at least things have been done, behind the scene and all that. Do we have enough manpower, and do we even have enough medication to see to it that at least this situation is contained for now?
For now, absolutely. If we are going to find strep pneumonia causing meningitis, it is quite, I don't want to say easily because people have died, but it is something that people should not die from, because our doctors should be able to treat. We have 2-3 options of medications that should be able to clear the infection. Now, it depends on how soon the condition is detected and what damage may have already been caused by the infection when they come in contact with the doctors. Because we understand, for example, the two who passed on, they were in the health facility for a very short period of time, which we suppose they may have had a problem and were struggling with it. By the time they came into the healthcare system, it was on the late side. So you find that those that are that have reported early and are in care, they are recovering and being treated. Strictly speaking, we should not lose a person if they make it to the health facility. We have the treatment for this in our facilities right now.
Any interventions that we are putting in place?
Unfortunately, and this is the challenge, because if it was that thing I talked about, the meningococcal thing, we'll be saying, avoid overcrowding, but this strep pneumonia thing, we find it in everyone. So really, what we'll say is that if someone has symptoms, you feel unwell, especially in those contexts, report yourself early so that you can be diagnosed and put on treatment to avoid negative outcomes. But in terms of massive public health intervention, given what we have seen so far, I think it's to inform the people that we know what's causing this, there's treatment for it. If you have symptoms, you feel unwell, go to the health facility quickly.
Can we maybe, in closing, attach the do's and don'ts to this kind of situation, where I would say, maybe, I know you have mentioned of not being clear as to what you can actually, point to, but maybe just to caution our public in closing. What would be your word to the general public in this situation?
Thank you for that question. I think that the biggest piece of information is what we call health-seeking behavior. You feel unwell, go to the health facility. I talked about the multi-pathogen diagnostics that we have. Don't say that one had similar symptoms. Remember where we started from. I was telling you that symptoms of meningitis can be caused by a whole range of things. So when you go to the health facility, they should be able to isolate the specific cause, because medicines, even antibiotics, they don't work for everything. They are specific.
Exactly.
So if we identify the specific problem, then you'll be given the specific treatment. Don't delay. That's the biggest message. You feel unwell, let's go to the health facility so that you can be given the appropriate care that you deserve. No one should die from this condition. And most importantly, I think the public must not panic. I think that it is unusual in the manner in which we've experienced this event, but the public should not panic. With what we have seen so far, I think it's something that can be contained, and it's something for which there is treatment in our facilities. And now the colleagues, the doctors, nurses, the health workers in the region and countrywide are alert, looking out to any of these symptoms. And I think that people should rush if they have any symptoms.
DJ, thank you so much for giving us this opportunity to talk to you.
Great pleasure. I
Thank
hope
you so
that we
much.
communicate to the public.
Definitely you
Thank
have.
you.
Well, viewers, we've come to the end of today's program. We are looking at the current situation in the country to do with meningitis. I had on set Professor Roman Chilengi, who is the Director General from Zambia National Public Health Institute. From me, Faith Mutale, and the entire production team, it's goodbye for now.